my name is Mary Kay, and today we are going to be going over a case and treatment planning. Today we're going to be talking about Josh. When Josh was 12 years old, his dad was diagnosed with brain cancer. After his dad received treatments such as chemo, radiation, and surgery, his dad's behavior changed. Josh had a hard time adjusting to his dad's behavior because his dad was no longer interested in doing activities such as hunting and fishing that Josh liked to do and was paying more attention to his younger brother. When Josh was 15, his dad passed away, and a year later, his mom did remarry. Excuse me. Since then, Josh has been presenting problems, symptoms, such as engaging in substance use, such as alcohol and marijuana, every day, and he will go to school high. His grades have been failing from C's to D's. He's been separating himself from friends and family and has trouble sleeping and staying asleep, and he's been having suicidal thoughts, ideation. Also, he's been having some reckless behavior. He does have 2 speeding tickets, and right now he is either facing jail time or a fine for being possession of a deer with outside of hunting season. Biological factors include substance use. Psychological factors include feeling angry at his dad for dying, and he copes with substance use to feel numb. Social factors include separating himself from his friends and family. He does not want to bond with his stepdad. He did have a good relationship with his mom and a younger brother before his dad passed away and before the behavioral changes in his dad. For diagnosis, I'm considering prolonged grief disorder. It has been over a year with his symptoms and his presenting problems. He's been having distress and impairment. He feels angry at his dad for dying. He has separated himself from friends and family. He rather just stays in his room by himself. He has suicidal ideation. He no longer wants to go to church. He has reckless behaviors, as I mentioned before. Before Josh's dad passed away, he stated his dad was his best friend. And he stated that he used to work with cars with his dad, go fishing and hunting, and Josh no longer is engaging in those activities. For a rule out, adjustment disorder, Josh's mom remarried six months ago, and Josh refused to bond with his stepdad. He has impairment with social functioning, deciding to no longer hang out with friends, arguing with his younger brother, no longer wanting to communicate with his mom. He only wants to spend time in his room alone, and symptoms have been lasting longer than 6 months. I did want to mention with the prolonged grief disorder, it doesn't mention that he has depression, but it seems like that his grief is causing him to have depression as well. Identification stage for presenting problems. Pre-contemplation for his substance use, stating he uses substances to stay numb, so it doesn't feel like he wants to stop. Pre-contemplation for his sleep issues, stating he has issues falling asleep and staying asleep, but he has not mentioned anything on how to try to improve his sleep. Pre-contemplation, avoidance of others. Report separating himself from his friends, not talking with his mom, and shutting himself in his room. Pre-contemplation, suicidal thoughts. He addresses he's tired of living and admitted to frankly thinking about ending it by going to his father's grave with his father's gun and killing himself. I believe this is also, all these are pre-contemplation because he also had issues with identifying goals for the future. Next, I want to talk about goals, objectives, and interventions. The first goal I decided is to, and they're not in order, but to improve sleeping habits. Objective: establishing a consistent sleep schedule every night for the next 4 weeks. Interventions would include educating Josh on the importance of healthy sleep, CBT. Discuss keeping a journal to track his sleep schedule, which would also be under CBT. Every week, we would discuss his sleep journal and discuss progress or if changes needed to be made, and that would be client self-evaluation. The next objective to improve sleeping habits is to increase his sleep time by an hour a night for the next 2 weeks, and then increasing it to then 2 hours a night for the following 2 weeks so that he's getting more sleep. For interventions, the objective: help the client identify triggers or distractions that causes sleep disturbances, CBT. Challenge negative thoughts into positive, CBT. Explore relaxation techniques to engage in before going to bed, CBTI, which is cognitive behavioral therapy for insomnia. Decrease substance use is our next goal. First objective for decreased substance use is decrease substance use from 7 days a week to 4 days a week for the next 4 weeks. And by doing this, then a month after that, I would like to decrease it even more. But just to have a start with him to decrease it. Interventions for that would be help the client identify triggers, CBT, build motivation for change by exploring goals, motivational interviewing, MI, and explore reasons for wanting to reduce, which would also be MI, motivational interviewing. The next objective to decrease substance use is to keep a journal and write down records of substance use and mood every time he has a feeling to use that he wants to use for the next 4 weeks. Interventions for that objective would be discuss and give feedback with the journal entry, CBT, explore coping mechanisms, replacing the coping that he's doing with substance use and replacing it with more healthy coping skills, CBT, and to also help Josh enhance self-awareness, which is also CBT. The next goal to be working on with Josh is to increase social interaction. The first objective with that is to engage with a friend or family member for 30 minutes, 5 days a week for the next 4 weeks. I'm hoping by this that he will see his support system as being helpful and not judgmental, but also to help him start engaging again since he has been shutting himself off. For interventions for that objective, I would use role playing to increase communication skills and manage conflict, CBT. It could just be where he doesn't know how to talk to someone about how he's feeling. So I feel like the role playing can really help him open up as well. Discuss how he felt before and after the interactions. So before he called that friend and family member, how was he feeling? And then how did he feel after engaging with them? CBT. Address ambivalence. Explore their feelings about social interaction and resolve internal conflict. Motivational interviewing. The next objective is to engage in a social activity 2 to 3 times a week for the next 4 weeks. I'm hoping this will help him get re-engaged with also friends. Interventions help Josh to identify activities and hobbies he enjoys during our sessions, DPT and CBT. Change negative thought patterns about social interaction, CBT. Behavioral restructuring to encourage Josh in social activities, CBT. The next goal is to decrease suicidal ideation. The objective for this goal is decrease suicidal ideation thoughts from 7 days a week to 3 days a week for the next 4 weeks. So for the interventions with that, sorry, I know I was also thinking in my head, but what I want to do during those next 4 weeks to kind of decrease it from 7 days to 3 days is challenge those negative thoughts and replace them with positive thoughts, CBT. Teach coping strategies to decrease suicidal ideation, CBT, and to discuss social support systems to call when needed. So if he's having a suicidal thought or ideation, I want him to be able to have that support system. And that's why also with the previous goal that I mentioned, increasing social interaction, is going to help him identify that support system to be able to rely on someone so he's just not sitting in his thoughts every day. So, I mean, it may seem like a lot, 7 to 3, but, you know, with talking more about Josh, it could turn to 7 to 4 or, you know, for the next 2 weeks and then go down to 7 to 3 for the 2 weeks following after that. It's really important to really speak with Josh every week. And then for the next objective, I would like him to journal at least 5 days a week for the next 4 weeks to track his mood and thoughts. It's kind of important to at least 5 so that we can understand a pattern that may be happening, triggers that may be happening. If he does 7 days, fantastic, right? But at least do 5 days. He is doing a lot of tracking with his moods, especially with the substance use and the sleeping. For the interventions I would use during that objective is to give feedback and positive reinforcement going over the journal and make sure that we're integrating the journal into the sessions. CBT, it's great to have that positive reinforcement to hopefully encourage them to keep journaling and keep going. We would discuss any negative thought patterns and then challenge and reframe them, CBT, and help the client to develop awareness to their emotions by developing techniques to stay present in the moment while journaling. Mindfulness. So staying present in the moment. What are you feeling right now? What are you feeling today? Not what you felt yesterday or 6 months ago or a year ago, but what are you feeling today? Why are you feeling this way today? To help stay present in that. And I'm hoping that would help him with his journaling and being able to track his mood and thoughts. I hope everyone got a little bit something from the case of Josh, and I hope that everyone has a fantastic day. Thank you so much for listening. Take care. Bye.